port is a semi-permanent IV that is placed under the skin into one of the large veins in the chest. The tubing from the IV is connected to a little chamber that is placed under the skin. The chamber is about the size of a stack of 3 nickels. Ports can be used to take blood or give medical treatment, such as chemotherapy. Not all patients need ports, but the reasons to get a port are based on the following. Chemotherapy can irritate the veins, and after a few treatments, it can be harder for your medical team to place an IV. For people who will be on chemotherapy for a long time, a port may be more comfortable and convenient for you. Some people have veins that make it difficult to place an IV. Getting a port is a short procedure that does not require that you stay in the hospital. Most of the time, you will need only local anesthetic. You may get a light sedative, which will make you a little sleepy, but is not like the sedation given for a major surgery. You will have a small incision or cut that allows the doctor to put in a port. After the port is inserted, you will have an X-ray to make sure the tube part of the port is in the right place. If no changes are needed, the incision is stitched up. Before the needle is put into your port, the nurse or doctor can put ice on the port to decrease the sensitivity of the skin. Some people need to use numbing cream on the port. As long as a port is used at least every 6 weeks and cleaned with saline, they can be used for a long time, even years. In addition to being used for chemotherapy, they can also be used to draw blood, to give IV fluids, and to give transfusions. Some ports can also be used to administer dyes for scans. Once a port is healed, patients can do normal activities such as showering, swimming, or exercising. No bandage is required, and there are no tubes showing. Ports have very few complications. Some ports don't work as well as hoped for and can be difficult to use. Your medical team may recommend a new port. Rarely, patients can develop infections around ports. There are different kinds of infections. Most of the time, the infection can be treated without removing the port. If you get a bloodstream infection, it may be necessary to take out a port. Call your medical team if there is pain or redness at the area of the little chamber or along the tubing, or if there is swelling or puffiness in the area of the port. Ports are usually removed after all chemotherapy is complete. They can be very helpful, and they can spare patients a lot of frustration and pain. If you have any additional questions about ports, reach out to your medical team. For more information on ovarian cancer education, please visit www.ovariancancerpodcast.com.